We're live.
Hello, all. Good evening. And thank you for joining us for yet another county town hall briefing meeting. We're always happy to do these and to share with you any information that we have, any new developments that we have. It's been a long haul since March of this year, and we're coming to the end of the year. I was just thinking that it's the start of the holiday season. And it's usually a time of, joy and happiness and just general, good tidings. And this year there's just this cloud that hangs over it. But for many of us, we can help bring a little sunshine through the clouds if we do what we've been asked to do in terms of trying to protect ourselves and each other from contracting this virus. It has been deadly in our community recently. It has been hurtful in our community recently. I have friends who have tested positive and who are struggling with it. It's been a rough one. This has been a tremendously rough year. But I know that with the start of the holidays, if we all just hunker down, get close to the people at home who've been in our bubble, closer to the ones who are on Zoom and virtually far away, and do everything we can. Wear a mask when we have to go out in public. Stay 6 feet away from folks. Wash your hands. Soap and water does wonders. And check on that cough or sneeze or anything unusual that seems to be happening with your health. We pray and send out good vibes that everyone in our community will continue to stay safe and have a great holiday. Tomorrow evening, I believe, is the start of Hanukkah. So let me be the first to say happy early Hanukkah greetings to everyone. In about 16 days, it's Christmas for those who celebrate Christmas. 17 days for those of us who celebrate Kwanzaa, it's Kwanzaa. And we'll all be celebrating the solstice in about 12 days. This is the holiday season. It's supposed to be joyous, and we want it to be joyous. So let's do our part to bring the joy into it, and let's not have any more deaths or hurt or pain in our community, especially if it's connected to the coronavirus. I also want to take a moment to say how much, as a legislature, we realize that our community has been hurting. The virus is doing more than just hurting people physically and emotionally, it's hurting us economically in our pocketbooks. Many, many people in our community are still struggling with trying to figure out, am I going to go back to work full time? Am I going to be able to? Is there going to be work for me? Am I going to be able to feed my family? Today, sitting on a call and listening to, colleagues and representatives from our federal congressional representatives just talk about people have to decide between, do I starve or do I go up and risk my life working and be exposed to this virus? It's a hard one. It is a hard one all around. Our businesses are struggling. We need help. And one of the things that we all can do to, again, bring a little sunshine is do our part in reaching out to our federal government. The shenanigans in the federal government is outrageous and unconscionable. Local governments, local communities, mom and pop businesses, small businesses, families need help. Stimulus funds, we have it. The richest country in the world, we have it. Our people should not be struggling with decisions of, should I starve or should I risk my life? Childcare opportunities, people need help. So please, I am asking all of you to call our congressional representatives, and even if it's not yours personally, make that call to Mitch McConnell. Call his line up. Tell him, stop playing with people's lives and give us the support and the aid that we need. It's not every year that we show up at the federal government with our hands out asking for lots and lots of support. It's not every year that we do that. This is an unusual year, and it calls for unusual measures, and it calls for unusual decision making. So please stop playing with our lives. Make that call and make that statement. Our children need it. Our communities of color need this. Our elderly community needs this. Everyone does. So we're coming to December 31st where things are going to change. Some of the protections that were in place are going to end. And there seems to be no movement to get it together to extend those protections. I am appalled, as I know many of you are, but we just can't wring our hands and say, oh, there's nothing we can do. We can pick up the phone. We can make those calls. We can send those emails. We can let people know that our citizens in this country need help. When we can work and support ourselves, we do. And when we can't, we look to our government to provide for us. I want to end my rant by just reaching out and sharing. This is the legislature floor, and I want to say in this forum as well, to everyone who's lost a loved one, and people who succumb to this disease, to those who are fighting, so that they don't lose their life. Tompkins County government, we stand with you, and we are sending you all the positive healing energy that we can send. We're sending you all the love and all the sentiments of comfort. This has not been easy for any of us, but I'm confident that there is a ray of sunshine somewhere, and all of us working together can uncover it, can make it just shine through the clouds. Thank you. Today we have questions, as always, some of the questions coming from your community, questions that are generated that we've gotten over email and others for a number of days. But we also have joining us today, Frank Krupa, our public health director, Amy Hendricks, our deputy county administrator, and also the person heading up our emergency operations center that's responding to this COVID-19 crises, our county administrator, Jason Molino, who manages all of it, including trying to keep county government going, and behind the scenes, Dominic Recchio, our communications manager, who helps us, navigate all of these systems and get all the press releases out and information shared. Thank you all for joining us this evening. Thanks to you, our public who tuned in as well. We're going to go right into it. And Frank, I think you have a slideshow you want to show us, so take it away.
Thanks, Leslyn. Yeah, I'm going to bring that slideshow up. Just give me 1 second here. I'm sure we can, maybe. There we go. So yeah, we're going to do something a little bit different. I just have a handful of slides here with some information we want to share to folks that I think will hopefully answer some questions. But before I do that, Leslyn, thank you so much for those words. I think you encapsulated what a lot of us are thinking and feeling right now, trying to navigate through this. And I think, you know, we have an opportunity here in the next few weeks to really make a difference in how we experience COVID in Tompkins County. And I know our community's up to it, and I know that we can do it and still bring that joy to the holiday season that we all want to have. So thank you so much for those words. So wanted to share some data with folks and kind of give a picture of what's been going on. I think probably by now everybody's aware that we've been seeing a pretty significant increase in cases. And then on December 7th, we had a 61 case day. Right, that's almost double our biggest day prior to that. So it was busy. Our nurses and all of the help that we have at the health department, they worked long hours and made a lot of phone calls to get to all of those cases. And one of the things that we found was that many of those were connected to small gatherings or travel around the Thanksgiving holiday. And I often get questions, well, how do you know it's from Thanksgiving and not from going to the grocery store or to some other exposure point? It's because we talk to every single case and we talk to them about where they've been and who they've been around. And we are able to make connections with active cases. And it's not just that somebody went to a gathering and they're the only one that got exposed. What we're finding is entire households, because a single person got exposed at some point and then came home. It created an opportunity for the entire household to contract COVID. So as much as I know it's so difficult during this holiday season, as Leslyn alluded to, we really are asking folks to limit those gatherings to your normal household members to limit the exposures. And I think one of the things that's important to note is we've had well over 1,000 people in quarantine, right? So along with all of those cases, then everyone that is a close contact of that case, now their life is upended and they have to quarantine for 14 days. And that just makes it the season even that much more challenging for families. So understand that we're seeing the same trend here in Tompkins County as we're seeing across the state in New York, and we really want to work to get that back under to numbers that we're more comfortable with. So our reminders, Leslyn, you covered these as well. They're the same. They've been the same that we've been talking about since March. You know, we want to use a face covering. We want to avoid crowded places, and we want to keep 6 foot of separation, right? Wear a mask, social distancing, low density, right? We've been talking about that forever. And I know folks are probably tired of hearing it from me, but those 3 things are still the most simple steps that we can take to help prevent the spread. We want folks to monitor themselves for symptoms as we come into the winter season. We get runny nose. The flu is out there. I also get often, well, why are we not seeing flu? You know, is COVID, is everything just COVID? Well, the reason flu is not as active as it has been in past season is all these same things we're asking people to do for COVID will help us prevent the spread of flu as well. So we would expect to hopefully have a milder flu season because of all the steps everyone has taken. But if you do have symptoms, get tested, get your flu vaccine if you don't, and please remember you're most infectious while symptomatic. So don't go to work, don't go to school, don't be around other people when you're symptomatic. That's the most infectious point. We've said it, and we're going to continue to say it for the next month or so. Stay home for the holidays. Travel, those small gatherings with multi households coming together are really what's driving our numbers up. And I know it's hard. I really do. But we've got to get through this season. A vaccine is on the horizon. A little bit more vigilance and patience. If we can take these steps for the next few weeks, it's going to make a huge difference in our experience. And again, travel is discouraged. I know, again, big time of the year for travel, but please, we want folks to stay home. But if you do have to travel, please follow the state quarantine guidelines so we can prevent spread from any exposures. Want to clarify quarantine and isolation. We get a lot of questions about this, and sometimes, particularly in the national media, you'll hear the word quarantine kind of used universally for anyone that has to stay home, whether they're sick or been exposed, but they have very specific definitions. And so for quarantine, it's for those people that are not yet sick, that have not tested positive, but might have been exposed to somebody who was. And so there is a 14-day requirement from the last point of exposure. So it's always 14 days, but for some people, depending on when we find out about the case and when the last exposure point is, we may call you and say, you're going to be in quarantine for the next 5 days, right? Because it took us it took the disease and the investigation process several days before we made the call to you. So I just want to be clear that it's always 14 days, but sometimes when you get a call, your release date might be shorter than that. There's also been a lot of talk about the CDC and their change in guidance around quarantine. I want to be clear that the CDC still recommends that 14 days is the best way to prevent the spread. They've added additional criteria to potentially shorten that time frame. New York State Department of Health has not adopted that guidance. They're still reviewing it. And until such time as New York State Department of Health makes a change, we will still be using 14 days as our quarantine. When you're in quarantine, we want you to look for symptoms. We want you to stay away from others with a separate bedroom and use a separate bathroom if you can. If you can't, we want you to sanitize the bathroom between usage. We also do daily checks for everyone in quarantine. Most of the time it's a text message. So if you're able to receive a text message, we'll set up an automated system and it'll just be as simple as typing yes or no to an automated text, and that's all you need to do. If there's a situation where something's changing for you, then somebody will reach out. If folks are unable to use texting, then we do daily phone calls. And like I said, if anything changes, you can talk, you can either respond to the text as such or talk to the person calling. And travelers are the only ones that can test out of quarantine right now. Isolation is what we do for those that are sick or that have tested positive, and it's at least 10 days. For most people, it's 10 days. Sometimes it can be more than that if you have underlying health conditions or you had a severe bout of COVID. But all of that is done on a case-by-case basis in consultation with our medical director at the health department, and we're communicating that with the case throughout, so there's no surprises about that. But for most folks, it's 10 days from isolation, which may seem weird, and we get a lot of questions because sometimes there's a family and the person that's positive gets out of isolation before the rest of the family gets out of quarantine, right? Remember, so isolation is about when you're infectious with the disease, and quarantine is about incubation period and determining whether or not you're going to incubate the disease. And unfortunately, that time is a bit longer than the isolation. So that does happen. Same thing, we check in daily. Of course, you can't go to work or school or other public places. You have to stay home. We want you to have a separate bedroom. If you're a case, we don't want you sharing a bathroom either. The risks are just too high. And again, we always want to monitor our symptoms. And if anything changes, certainly call your healthcare provider or 911 if it becomes emergent. So New York State's winter approach to combating COVID-19, we just wanted to talk a little bit about what we're doing here locally on each parts of this approach that the state has developed. So managing hospital capacity we've been doing right along, and we have a great partner in Cuyahoga Health System who, while we've seen more hospitalizations over the last few weeks, they still feel that they're in a strong position to address the disease as it evolves. But really what we're trying to do is keep people out of the hospital. And that's our main goal with all the steps we're asking people to take. Increase and balance testing resources. We've been extremely fortunate again to have Cuyahoga Health Systems as a partner to have the level of testing, and that and coupled with our legislature's commitment to financing and paying for testing for any Tompkins County resident, has really put us in a good position. So we would encourage folks, particularly if you're symptomatic or have had close contact, to get tested. But testing is available for anyone that's a resident of Tompkins County at no charge. We want to keep our schools open safely, and we've been working tirelessly with our school districts to help them do that. Obviously, there are moments when we have cases within the schools that require some temporary full virtual days, or perhaps even a week or so to allow the schools to adapt. I want to be clear that we are not seeing transmission within the schools. Mainly when we're seeing schools go fully remote, it's because the adults that are needed to run the school and supervise the children are being quarantined because of exposures. And that's really been the reason districts have been making those determinations. So we just want folks to know that things aren't happening in the schools. At least we haven't seen a large amount of transmission. We want to prevent viral spread from small gatherings. You've heard the governor on his press conferences talking about this. I've been talking about it continuously. It's probably the hardest thing for us to do. Our families, our homes are our safe place, right? And we might invite friends or extended family over, and we think we're safe because we're in our home. But unfortunately, with this disease, that is the place where we're transmitting it, and we want to protect ourselves and our families. So please help us by avoiding those small gatherings. And then we want to operationalize an equitable and safe vaccination program. So it's important for our community to know that we've been planning for medical countermeasures, which is just a fancy way of describing how we provide vaccines or other medications in an emergency, for 2 decades now. And so we have strong plans, we have great community partners, and we are prepared to fit into the states and the federal government's distribution plans as soon as vaccines available, to make it available in our community through the priority groups and then to the general public. So I think I covered most of this slide, but we are working through planning. We submitted a plan, which was really just, we have a medical countermeasures plan. Here's how we plan to use it for COVID. It's been approved by the state, and we're just waiting for vaccine to be available so we can deploy it. We have meetings regularly with the Cuyahoga Health Systems and other community partners to figure out the fine details of how we're going to administer the plan. And we've been talking with all of our different community partners about where we might have the pod locations when the time comes. Everyone probably wants to know, where am I going to get my vaccine? It's really going to depend on how much we get and what priority group we're in those moments. And we'll be making strategic decisions on how to most successfully get it to those populations in the best way. So stay tuned. We will be very clear about where you can get your vaccine when the time comes. New York State has announced that the first round, which we're expecting within the week, is 170,000 Pfizer vaccines. And today the governor told us that's about 4,500 for our southern tier region. And so those are being prepared for distribution with our hospital systems and to our long-term care facilities. So our healthcare workers, priority healthcare workers within the hospital, and then our long-term care residents and staff as well. And we have created a space on our website for vaccination information, so please check that regularly. We'll make sure that we continue to keep that updated. And that is all that I had. So I'll stop talking and turn it back to you, Leslie.
Thank you, Frank. I have a new terminology: medical countermeasures. I like it.
Right. You can't just
go out there and talk like I know what I'm talking about. Anyhow, thank you for that, and thank you for clarity in that information as well, especially the guidance is coming from New York State, and the fact that we'll get some of the vaccines here in the southern tier. I was really afraid that they'll all go to New York City, and we'll wait for the second round. So it's good to hear at least there's some that will be distributed to other places like the southern tier region. Appreciate it. All right, we're going to move on with our line of questions, some of the questions that we've received. And Amy, why don't we hear your voice this time around? Let me ask, why doesn't the health department, this question always comes up, why doesn't the health department or the EOC provide more comprehensive breakdowns of the demographics of positive cases?
Okay. Yes, that question comes up frequently. So we provide age, race, ethnicity, municipality, and how many people do, where they're contracting the disease, and where they know it and where they don't know it. We do that regularly, and we usually do that in some of our legislature updates as well as on the website. That information is completely up there, and we update it once a month. The reason that we do that is because in the beginning of this, we were having very small amounts of cases. And so to protect the privacy of individuals, we really wanted to make sure that we weren't bringing all of that information together. So that's why we've been doing it for once a month. We haven't seen the cases really skew from our demographics within the county, but that is something that we continue to watch. When you look at the national news and how things are trending, we want to see where we're trending. So we do watch it regularly, and we provide that information. But we wait until we get to the point where we can protect the confidentiality of those people that may have contracted COVID-19. So there's a big piece there. On top of that, the other piece to this is we also get the question about public exposure. Sometimes we say, if you were at Wegmans during these hours, or if you were at this other grocery store, or wherever it may be, lots of different businesses, then you may have been exposed to this. Now, people ask why we don't say that all the time. And that is because what Frank just talked about with the contact tracing and investigation process, when we talk to the individual that is tested positive, we can determine where they've been and what the risk of exposure is to our community. And so that's, if we understand that the risk of exposure is higher because they are in those public locations, then we would go through that. And we would also ask about their interactions in those locations. So it looks different depending on, if we were to use the store example, if it's a front-facing employee that's interacting with customers, or if it's a back-end employee who's maybe only interacting one-on-one with other employees. So we do spend a lot of time thinking about what information we release and what information we don't. And what it really does come down to is how we protect the rights and privacies of each other, while also protecting the public health of the community. So there's a lot that goes into that, and we'll continue to publish that information on a monthly basis.
All right, thank you for that. So as you said, as things, depend on where it falls out, the information that we share might change, but the essential part is protecting people's privacy, confidentiality, and so on and so forth. But we've been doing better in terms of sharing information. So thank you all for that. Frank, there's a question that came in that relates, thank you, Amy, that relates to the slides that you just had on the 4,500 vaccines. And the question was, do we know how many healthcare workers, long-term care workers we have in the Southern Tier? Basically, the question is asking, would 4,500 vaccines be enough?
Sure, the short answer is no. But the good news is vaccine will continue to roll out each week as the federal government gets more into their supply and then distributes it to folks. So within those priority groups, we'll be beginning with prioritizing healthcare workers in the hospital, mainly in the emergency department, in the COVID wing, as well as in the ICU, right? Those folks that are most likely to be around acute COVID patients. And then it will go out from there as we get more vaccine. One thing to point out, Leslyn, is that New York State has opted in to the federal government's long-term care vaccination program, which will be using private pharmacies like Walgreens, CVS, and a few others to handle logistics and administration within our long-term care facilities. So they will actually be going to those facilities, prioritizing first nursing homes, supervised nursing facilities to get the staff and residents there vaccinated. But throughout the next few weeks, they'll be working to do that for all of our long-term care facilities. So the pool of vaccines that we're going to be using for healthcare workers has already had the long-term care allocation taken out and kept by the federal government in order to support that program for the long-term care. So it's really great to see public and private partnerships coming together to get the vaccine out as quick as possible.
That's good, and it's good to hear that they'll keep rolling. Vaccines will keep coming through the weekly. That's good to know. Frank, I'll stick with you. I have another question for you. Sure. At what point is an individual considered to have recovered from COVID? I mean, that question comes up a lot. Sometimes you're recovered, but you're still contagious, if that makes sense. So people keep asking that question. So basically, what's the difference between recovered and released from isolation or quarantine?
Yeah, recovered is not a very specific word. And back in March when whenever it was, we started reporting it, it was clear enough and it met the need. Really what we're looking for from us is we're reporting when someone's no longer contagious. So that's after the 10 days, generally speaking, as I said in the beginning, that we consider somebody recovered because they're no longer contagious. They could still have some minor symptoms, but generally we want to see them be fever-free and be recovering and have their other symptoms improve prior to that 10-day release. And like I said, in some instances, there is reason to keep people in isolation longer, and we handle that on a case-by-case basis.
And testing negative does not necessarily mean that someone is not contagious, right?
Well, testing negative, we used negative tests to release people or to say somebody was recovered. But what we found is that people can test positive for months, 2 up to 3 months past when they first became infected, but they're not infectious during that time. So we don't use negative testing to release people from isolation. It's based on the understanding that normally within 9 days, you're no longer infectious. So we use 10 days just to make sure.
Okay, we continue to learn more and more about this disease. Frank, a few more questions for you. There have been a lot of questions around mask wearing in businesses. It continues ever since we started this. So the question says, I've seen some employees at local businesses, specifically large box stores, wearing face shields instead of masks. Are face shields acceptable for these employees to be wearing?
So guidance has recently changed that face shields are no longer considered an acceptable face covering. And it does kind of align with what we understand. Generally, face shields are designed to protect the wearer, and it's to protect the eyes and other mucous membranes from getting in contact with infectious material. So using them in exchange for a face covering really isn't what they're designed for, and particularly they're open underneath. So if you're coughing and sneezing, they're not doing the same level of containment as a cloth face covering would. So I think this really makes sense based on what we know about the disease, but we do know it's going to be a change, and that folks, we're going to have to be patient with folks as we make that adjustment and we get folks to wearing a face covering rather than a face shield.
All right. Another question, as we all go out to the grocery stores getting ready for the holiday, in-home gatherings, is there any evidence through contact tracing of community transmission at grocery and retail stores when wearing a mask 100% of the time?
Yeah, we get that question a lot, and it's really hard to define what is wearing a mask 100% of the time. I think we all, if we're true or being truthful with ourselves, we've messed up, right? We've pulled our mask down, we've forgotten it, or it slipped down below our nose and we didn't realize it. So I don't think we could ever say anyone has had 100% effective mask wearing. So to the second part of the question, have we seen, direct exposure from folks in those type of settings? We have some suspicions. it's hard to always find the exact connection. What I can tell you is it's much more likely that you're going to be exposed with longer close contact within your home. But the science absolutely tells us that certainly when eating in restaurants, we're not wearing a mask, we're in an enclosed space, the disease spread can happen. We're really just trying to be cautious, right? When we're talking about exposures in restaurants and grocery stores and the such. So it really is, the mask wearing is one component of this. Mask wearing isn't perfect. Even if everyone wore a mask, we would still have some disease transmission. So it's really a combination of everything that creates that barrier to help prevent the spread.
Thank you. Amy, I'm going to jump back to you. Thanks, Frank. For those who choose to travel, and I hope nobody will, and return to the community, where should they seek a test after 4 days of quarantine so results come back quickly, and how much would it cost?
Sure. So I'm going to start with the assumption that this means that they've received a test 72 hours prior to coming back to the community. So just to be clear that there's two tests involved with that travel. Otherwise, the 14-day quarantine applies. So if someone comes back and is seeking that test, there are two sites available here in Tompkins County that are in partnership with Cayuga Health Systems. There is a large sample site at the Shops of Ithaca Mall, and that's been there since March, I believe, or April last year. It's around the back of the mall. I know some people got a little confused because it has shifted back to where Sears once was. That testing facility is open 8 to 4 or 8:30 to 4 Monday through Friday, and they have had Saturday and Sunday hours recently as well from 8 to 1. There's a second site that we have opened with Cayuga Health Systems at 210 North Tioga Street. And so that is a walk-up site. There is parking available, but we're encouraging it really for the downtown community so that people can walk in and go ahead and take tests there. Both sites you can register for online at cayugahealthsystem.org. And they are appointment-based. So people sign up and they can go and get tested there. As far as paying for that, for Tompkins County residents, the legislature approved funding to cover our Tompkins County residents for testing when they don't have symptoms or when they're traveling. And so that has been provided. If it's a non-Tompkins County resident, there is I think it's $99, and that's all on the Cayuga Health System site. So they would have to pay that, but it is all there. And we do continue to have all of that testing available.
And just one piece of clarity, Leslyn, if you're symptomatic, there's no charge either.
Right.
It's billed to your insurance or it's considered medically necessary and compensated. So when Amy was saying if you don't have symptoms, it's free of charge, that's an additional benefit that the county has created for us. So if you're symptomatic, we definitely want you to go and there's no charge to worry about.
Yeah.
I'll definitely shout out to the Tompkins County Legislature for their funding to make that happen. And also thank you to our partners at Cornell University and Cayuga Health Systems. We don't always get it right all the time, but sometimes, the times when it mattered, we get it right on and protecting our community. If you will indulge me for a quick minute, Amy, I just want a little more clarification on the 72 hours
Right.
testing pre-travel or whatever it is you just said. What was that?
So the travel guidance has changed a little bit. Originally, it was the 14-day quarantine, really pushing that. And what the guidance changed to is prior to leaving the destination that you're at. If it's a non-contiguous state, so there's lots of pieces to all of this. So that's, I think, why we get a lot of these questions. So if it's a non-contiguous state, 72 hours prior to coming to New York, you would need to take a test. So you would find a testing site, go ahead and take that and get your results back 72 hours prior to coming here. And then you come here, you quarantine for 3 days, and on day 4, you would receive the test here. And those 2 negative tests would release you from that quarantine. So you're released at a quicker rate than the recommended 14 days. There's been a lot of discussion and changes within quarantine, and I'm sure Frank will talk more about that in future questions as well.
All right. Thank you. And since you mentioned Frank, I'll go back to him. And then Jason, I've got a couple of questions for you. So stay awake. Frank, as COVID-19 is airborne, should the guidance be that anyone indoors should be wearing a mask regardless of whether they can keep 6 feet of distance or not?
So I think, as we've said before, all of the guidance put together is what creates the best protection for us. So what we want is folks to wear masks. Indoors, you never know if you're going to come into contact with someone, so it's a good idea to have your mask on, particularly if you're in public spaces. You don't know who's going to walk around that corner or such where you might have a chance to bump into someone. It's the 6 foot is really designed around what we know about how we express through our breath or coughing or sneezing. And if you're coughing and sneezing, you should be home anyway. But even if you're just breathing, the idea being is if we're wearing a mask and we're more than 6 feet away, the chance that the virus is going to be in the air long enough for it to infect someone else goes down dramatically. So we're trying to take steps and give guidance that are the least restrictive they can be while still giving the maximum amount of protection. And so that's why we talk about mask wearing and 6 feet. I would encourage folks to wear a cloth face covering when you're going to be around other people, right? Even if you think you might not get to that 6 foot, but the guidance is 6 foot and wearing a mask if you can't maintain that.
All right. Continue with you, Frank. How effective are the mechanical ventilation air purifying systems that some businesses and schools are using?
So they are good and they help, but they're another piece in the puzzle, right? Them alone will not prevent exposure. So again, we're coupling all of these different precautionary measures together to create the most protective factor that we can for everyone out there. So we're very happy that our local businesses have taken the steps that they've been asked to around air handling, and that coupled with our community continuing to follow the other guidance will all be the pieces of the puzzle that keep us protected.
Mm-hmm. Mm-hmm. This could be for either you, Frank, or Jason. What are recommendations for high-risk individuals such as seniors with pre-existing conditions? Should they be staying home and having others shop for them? Should they not go to other indoor spaces at this time? We've received various questions from concerned family members whose aging parents don't know what to do, or they want to go out. So what's your guidance for them?
Yeah, I mean, my first direction or guidance, if you have an underlying health condition or you're elderly, staying home is your best course of action, right? Trying to limit exposures to others. And I know it's hard. It is really, I deal with it with my mother as well. And it's challenging, and we want to hug our loved ones. But that hug could be the thing that transmits the disease to them. So if you have a circle of support that can do your grocery shopping and other errands for you, that would be your best case of your best course of action to protect yourself. If you're going to go out, be very careful, wear your mask, make sure you stay away from folks. Understand that we have complete control over how close we get to another person, right? So if you decide you want to go shopping and you show up and the place is packed, maybe you go home and come back another time when it might be less crowded. So we really got to take that personal responsibility and try to not put ourselves, particularly if we're vulnerable, into those situations.
Mm-hmm. Anything you want to add, Jason?
Sure. Thank you, Leslie. Yeah, I would just add that it's important to keep in touch. As we experienced earlier in this process, we talk about back in springtime and early summer, it's important to keep in touch with all our loved ones and our friends and family. So to the extent that we can make use of anything from a phone call to a FaceTime to a Zoom, we have Zoom meetings every day, but Zoom discussions or conversations with family members, while it's not the same as obviously being in person, let's not forget to make those extra calls every once in a while to ensure that our family members and our friends know that we care about them, and probably just more to listen, particularly if folks have to be staying inside for extenuating circumstances, our grandparents, our elders, whatever the case may be. We should take that extra step and try to take that extra step for all our family and friends and loved ones. We do it in our family, which is incredibly difficult, talking to our grandmothers and great grandmothers that haven't seen their grandkids and great grandkids. While it doesn't replace the fact of seeing them in person, it's better than nothing at all. So we schedule regular FaceTimes with our family members internationally as well, so that we can stay in touch and at least we can see each other.
Thank you. Good advice. Frank, if at least 100 of the 290-ish current cases do not know where they were exposed, does that say something about how the disease spreads or something about how much care people took?
It's probably a little bit of both, actually. I mean, what it tells us is we have community spread, right? That we're not able to draw a direct epidemiological line back to a positive case for that individual. And so it means that the disease is in our community, and the more disease we have in our community, the more likely you can get it and not know that you were exposed to someone. I don't want anyone to think that because they got COVID, they failed. Right? I mean, this is hard. This is all hard stuff, and people are trying their best. So it is possible to do everything right and still be exposed. That's why we have all these different layers that we're asking people to take to try to limit those. So it could be a little bit of both, but I don't want people to think that it's a failure on their part. It's a disease, and it's hard to limit all exposure. So just continue to try to do the best you can. And if you do contract it, we're going to do everything we can to help you make it through and have a great recovery.
Thank you. A couple more questions for you here, Frank. When the vaccines start, how do we know if a person who has been vaccinated might be infectious? Is there a way to test them to see if they are still infectious? If they are, will everyone who is vaccinated be told to avoid others for a certain amount of time? Several layers to that question.
Sure. No, really good question, though. It's important to talk about how these vaccines work, too, as I touch my face when I'm not supposed to. See how hard it is? The vaccine requires 2 doses, right? So you get your first dose that starts your body's immune reaction to it, but it doesn't give you immunity. It really takes that second dose or booster to really kick your body's immune system to creating the antibodies and being prepared to fight off any future infections. And even it takes about 7 to 10 days after that second dose for your body to fully prepare itself to defend against any future exposures. So it does take some time for that immunity to actually occur. So we'll be continuing to test and do isolation and quarantine for some time as we get the vaccine rolled out. It's not as if because next week we might be vaccinating people that we're immediately going to go back to normal and stop doing all of the public health interventions. It will take time. Certainly if folks become symptomatic, they'll be working with their healthcare providers to try to determine. Not every vaccine is not perfect. Right there, I think we've heard about the Pfizer being the one that's coming out first being in the 90%. Others might be in the 70%, right? But that's still way better than nothing. But we still have to be careful because for some folks it might not work. And that's the whole point of needing so many people to get it, right? We need people to get vaccinated. So for those that it doesn't work for, there's such limited opportunity for the disease to jump from person to person that it just won't survive. And that's really what we're going for.
All right, I'm not a medical professional, but it certainly does remind me of when you get antibiotics from the doctor, for, bronchitis or one of those things. And they're like, well, you have to finish this entire dose and it's so many days before you're not, contagious anymore. So it's a very similar thing, just because you got the vaccine doesn't mean, we throw out our mask and start doing all the things we're not supposed to do, because it'll take a while for it to work. So thank you for that clarification. Amy, the CDC suggested that individuals who are asymptomatic can quarantine for 7 to 10 days instead of 14 with a negative test. I'm not going to ask you what's the health department's position because Frank is on the line, but what do you know from the EOC and that you share with folks about this?
Sure.
What's our local quarantine requirement? You mentioned something about it earlier.
Yes. I thought Frank was going to answer this one, but I'll take it in. So the quarantine requirements. So what the CDC has suggested is that if someone can't be successful in quarantining for those 14 days, that they could get tested at the 10-day mark and be released from quarantine. We do follow New York State Department of Health guidance, and at this time they are reviewing that, and they're reviewing those recommendations that in between the 7 to 10 days mark to see if then people could test out of quarantine. But like I said, when you really look into the CDC guidance, it still talks about that 14-day quarantine period, but we want to make sure that people are successful in doing that. And so having that test allows us to at least check in prior to releasing someone, but we have not shifted our guidance at New York State Department of Health or even at our local health department at this time.
All right. I just wanted to hear your voice in there.
Thanks, Leslyn.
Frank, I'm getting back to you. Why are people encouraged to get tested when the health department sends out a public exposure notification, but the individuals who are identified as close contacts through contact tracing are placed in quarantine are not recommended to seek testing?
Yeah, okay, good question, Leslyn. And let me kind of walk through that. So if somebody is a close contact and we can identify who that person is, we don't want them to get tested the first day after they've been exposed, because we know the disease has an incubation period of 2 to 14 days. So if you were exposed today, if you go and get tested tomorrow, that exposure is not going to show up in that test because you will not have developed it that quickly. So what we recommend for those people is that they get tested between day 5 and 7, because that's the average incubation period. And that's when you're most likely to test positive. It doesn't mean that if you test negative, you won't become positive, because people have tested positive on day 14. But that's why we recommend those folks wait. For the general, when we do the releases, because we haven't seen a lot of exposure from those types of settings, we in the early days we recommended anyone that was under one of those public releases quarantine for 14 days, and we backed off of that because our experience has been we have not seen a lot of exposures through that route. But because we have testing available, it doesn't hurt to have those folks go and get tested, and just to make sure that they're not positive, or perhaps they were the exposure for that worker in the workplace, right? Because we're also trying to find the potential, index case for that individual as well. So that's the reason for the difference.
Okay, so let me ask a quick follow-up just for further clarification. So let's say I ran into a store and I just noticed the TOPS is, public exposure and the list, just came out today. So I ran into TOPS 10 minutes. I used the self-checkout. And it's during the time that an employee tested positive and you sent out that public notification of a potential public exposure. Should I go get tested?
So we recommend that if you meet the criteria that is in the public release, that go and get tested and just make sure that you're negative. It's a recommendation. There's no requirement. Nobody's going to check up to see that you did it. And we're not telling you to quarantine. We're just asking you, you might have been exposed, so keep an eye out for symptoms for the next 14 days to make sure that you don't become symptomatic. If you did, then we would definitely want you to go get tested at that point, but we want anyone that's symptomatic to get tested. So it's really a personal decision. We're just trying to offer what we think would be the best course of action, and each individual gets to make, that determination for themselves in that situation.
Frank, I think you might have answered this question just a moment ago, but I'll ask if you want to add anything else. So someone found out that they was in close contact with somebody who has COVID-19, and immediately the person ran out to get tested. The test came back negative. The contact tracer who called said that the person should quarantine. How come?
Because the test only tells you in that moment of time whether you're positive or negative. And we've talked about the incubation period. So
Right.
Any point between day 2 and 14 from exposure, you could incubate the disease and then test positive. And that's really what we're looking for with quarantine. So you'd need to stay in quarantine.
Thank you. It bears repeating. Appreciate it.
Sure.
Another question that came in for you, Frank, said, I've been caring for my child who has COVID-19 and now is ready to be released from isolation. But the health department says I need to quarantine for an additional 2 weeks. Why do I have to quarantine for this additional 2 weeks?
Yeah, we get a lot of frustrated families because of this. So it's really based off of the science, and I'll walk you through it. So if your child is a positive case, what we would want is that child to isolate away from everyone, have their own bedroom, their own bathroom, and not have contact with anyone. We recognize that particularly for young children, that's just not possible, right? They need their parents' support. And so the parent has to violate the isolation, for lack of a better way of describing it. And so they're continually being exposed during those 10 days that the child is infectious. So their quarantine doesn't start until their child is no longer infectious. So the child goes through the 10 days, and now the parent's last day of exposure was day 10, and they need to wait 14 more days before they would know for sure that they didn't contract it from their child. So it's really difficult. People get really frustrated with this. For families, if they're fortunate enough to have 2 caregivers in the family, we often recommend that one quarantine or isolate with the child and the other quarantines away from them, so that they can go to work, that they can go and do the grocery shopping and do the things outside of the home. And so you kind of split that up, so one person can be with the child and the other doesn't have to be in quarantine as long. So we do try to work with families when this situation comes up to explain it to them, but it is hard sometimes when your child comes out of isolation and now we're telling you, sorry, you've got 2 more weeks. So we get it, we do understand, but it's really the science behind how the disease develops.
Yeah, thank you for that explanation. I wanted to understand it myself. Amy, I'm gonna jump back to you. From an emergency planning and preparedness place. With the increase in local cases, what should we think about in preparing for the possibility of being asked to quarantine? What's our quarantine preparedness kit, so to speak?
It's a good question, Leslyn. I think a lot of people are having that similar question and conversation in their own homes right now about what would you need. So the health department does have a nice list on their website, so you can look at that. But really, if you're anticipating that you may need to quarantine or to prepare to quarantine, consider what you need kind of in your own home. It's similar to like a winter preparedness. Do you have the food and personal items? How are you going to get groceries? There's a lot of really good grocery delivery services. If you're in the rural community, you may not have the delivery service. So do you have close contacts or family or friends that could bring it to your door if needed? Do you have all the cleaning and hygiene products that you need? What kind of phone or internet access or other things like that? How are you going to connect to others? And I think really having that local person that's a contact is extremely helpful. With that being said, our contact tracers, as well as our staff and everyone at 211, have been really helpful in people that are quarantined or isolated, helping them get the supplies they need. The other piece that I think sometimes we forget about too is if you have pets, making sure that you have supplies for them as well. And that's just a recent thing that came up, is ensuring that, you know, both you and your pets have any other medications that you need to have. So really stocking up, and not stocking up to the point that we have, you know, a toilet paper outage, but making sure that people have supplies at home. So really, it looks like winter preparedness prep, just to prepare for quarantine, 14 days worth of supplies.
All right. And you mentioned 211. It's important to sort of reemphasize that if people feel like they don't have the means to get, you know, those 14 days worth of supplies, so please reach out. We have resources in the community that can help with that. Give 211 a call. It's our gym. Jason, I'm going to turn to you. And by the way, for me, peanut butter. Just supply me with peanut butter. I will survive, and water. I will survive. Jason,
Sure.
the holidays are upon us. They're here. It's not approaching. It's here now. And over the Thanksgiving, we know that we had some concerns. What lessons are learned from Thanksgiving that would inform families on Christmas, Hanukkah, Kwanzaa celebrations? What should we be doing?
Sure. Well, first of all, Leslie, you know my key ingredient to stay in quarantine is gummy bears. So you have peanut butter, I have gummy bears, but you know that. Sure. Lessons learned. I think it's important to acknowledge that, you know, the holidays, particularly towards the end of the year, are generally a time where we get together with family, we get together with friends. It's a normal time that we do that, and we do it probably more frequently towards the end of the year with Thanksgiving and the Christmas, Hanukkah, Kwanzaa celebrations. The lessons learned, I think, and we had forewarning that this would be the case, and I think that's come to fruition, unfortunately, is that when we do that, we do everything that Frank has just illuminated us to, is we create greater exposures. I don't think anybody intends to transmit the disease to each other, particularly your family members, but when you start to get together with folks outside your immediate household, which is generally what you have less control over, you know, your immediate household, you know, you have more control over as to where people are going, who they're exposed to, how frequently they're going out. When you get together with other family members that you don't have that level of control over, you don't know, unfortunately, who they've been exposed to, where they've been, et cetera, et cetera. And that just increases the probability that you may come in contact with someone who has tested positive for the disease. So I think what we're seeing over the past several days, probably week and a half, is a result of folks getting together, traveling. We encourage people not to travel to the extent that they don't have to. That's a huge inconvenience when you think of what we normally do during the holidays, which is get together with our extended family. That's hard to do that, but unfortunately, this is one of those years where, and it may be the only year, hopefully the only year we have to do this, where we just are encouraging folks not to if they don't have to. And that's because you're just opening yourself up to probability of potentially more exposure or more opportunities to be exposed. And whether that's with, even if it's traveling, when we talk about travel, it's not like traveling across country, even traveling to other households, whether it's in the region, in the state, you're still taking that risk. So I think that's the biggest lesson to be learned. I think we would anticipate cases will probably continue to increase over the course of the next week from Thanksgiving. We'll continue to monitor that. And unfortunately, if that continual gathering happens for the Christmas and Hanukkah and Kwanzaa celebrations, and probably New Year's, which it would be interesting to see what happens in New York City with the ball being dropped this year for New Year's. I don't know how that's going to work out, but we'll see what happens. Those are situations that increase exposure, and if that's the case, then probably 2 weeks following the New Year's break, we'll probably start to continue to see a rise in cases. Hopefully, that's not the case. And I mentioned this before. We have the ability to stop that. We have the ability to monitor that behavior and not participate in those activities if we choose. And if we do, we'll see a positive impact. If we don't, I think we take a risk of increasing caseloads.
Thank you. And like many people, I've been paying attention to the color changes on the whole United States map. Given what you just said, will we be in danger of becoming yellow or orange, being in those zones?
Sure. So the state has created these 3 zones, yellow, orange, and red, these kind of microcluster zones, and they're based off of a 7-day rolling average of positivity rates for 10 days or 15 days with new cases and so on and so forth. So there's some math that's behind it. So far, our 7-day rolling infection rate is about 1.93%. We'd have to be close to 3.5% to get into a yellow zone. What does that really mean? What we've seen so far is communities or regions that have identified into the yellow, orange, and red zones, they have greater restrictions, whether it's restrictions on public gatherings, restrictions on in-person dining or indoor dining, and other restrictions. They also come with some restrictions on in-person schooling and additional testing that would need to be taken place in order for in-person schooling to continue. So right now, I don't think we're in a position to see us come into a yellow zone. Obviously, we don't want to. We don't want that to happen. So everything we can do, everything Frank and Amy and you have talked about today is important. The mask, covering the less density, avoiding places where there's a lot of people to the extent we can. That'll be able to curtail our infection rate and hopefully prevent us from becoming into a yellow zone. And I think we have the ability to do that. One thing this community has been great with has been responsiveness to what we're asking them to do. I don't think it's by coincidence that this community has achieved probably much more than most in the state, if not the region in the country, when it comes to the collaboration around testing, when it comes to the ability to communicate publicly and the ability for compliance. So I think we're in a good position. We have a good foundation, a good group of the public, and the community understands what they need to do. And I think we just want to encourage them to continue to do that.
Thank you. Frank, I'm going to jump to you and ask, because we've seen what's happened in one of our nursing homes here. What do nursing homes do to protect residents once COVID lands in a nursing home? What are they supposed to do?
So I think first thing to say is nursing homes are doing a lot to try to prevent COVID from coming in. There's testing requirements for their staff and folks that come into the facility. They've limited visiting. There's procedures for how that all should work. So they're doing yeoman's work of trying to prevent it from happening. But when it does, there's rules and regulations that New York State Department of Health has put in place and provides oversight of the facilities when that happens. Most of it's around cohorting. So if you have positive patients, you put them together in one part of the facility and the folks that aren't in others. If you have close contacts of a positive case, you might put them in another cohort. Obviously the staff, there's different PPE requirements when you have a positive case in your facility and how you address that. So they take significant steps to try to prevent the spread. But what we know is congregate living is a perfect transmission place, right? People are close together. They're indoors often. And so transmission can occur. And unfortunately, they're our most vulnerable to this disease, and we see those unfortunate tragedies. But I talk fairly regularly with all of our long-term care facilities. I can promise they're doing everything humanly possible to try to help keep the folks in their residences safe. Those are their people, right? They care for those folks. They chose that profession for a reason, and I can promise you they hurt as much as anyone, except maybe the immediate family of the individuals when these tragedies occur. So they're doing what they can. There's regulations in place. There's guidance to help them understand what to do. The state provides oversight when cases start to occur, and obviously we're a local resource to them if we can be of help.
Thank you, and thank you all for your patience. I know we're running a little over time, but these are important questions, so please bear with me. Jason, would the county ever step in to recommend that a school goes remote, even for a short period of time, to assess the situation, to determine if there is truly an outbreak? I mean, Frank talked a little bit earlier that it's not really outbreaks in the school, but if that, yeah. would the county tell the school to shut it down?
First of all, I think it's important to acknowledge that the school districts, I think, are doing a remarkable job. They are balancing something that I don't think was imaginable before, and I think they're doing just a remarkable job trying to manage providing the best opportunity for students to be educated while managing this disease and all the impacts that come with it. As a parent, it's difficult. The parameters around, if your child has the sniffles and what has to happen for them to go back to school, balancing remote work versus in-person work, and all the fears and anxiety go with it. So first off, I just want to say the schools have done a remarkable job, and I compliment all the boards of education and the superintendents and staff for trying to do this. And I think it's safe to say that everyone in the school districts would rather be doing in-person teaching than anything. I think they would rather be there with their students in person. That said, this is going to probably be circumstantial, some of it, and it's a constant communication. I know Frank has regular conversations with the superintendents, both as groups as well as individuals, and I think it would be a circumstantial, depending on the circumstances at hand, what the case situation may be and why. I can tell you that, and Frank, you can add more to this, many times when classrooms or buildings or school districts go remote, it's not because there's been an outbreak, but because close contacts of one case are so voluminous that it makes it difficult to staff a class or to staff and support the school district. So it's not necessarily that there's an outbreak of cases, but one case could have 50, 60 close contacts, and those people then have to quarantine. And that's a good thing to that context from preventing the disease from spreading. So I think the answer is yes, it could depend on the situation, but rest assured that if there was an outbreak in a school district, the public health department, Frank, we would all be very much hands-on and in communication with that superintendent to support them in any way they need to be able to make the decision that's best for them.
Thank you. I appreciate that. Just a few more questions and a couple of follow-ups that came through. Frank, according to the New York school report card, Groton currently has 7 cases within 7 days. 2 at the elementary school, 5 at the middle high school, 1 for a student who's considered off-site. Will the community be alerted if this is found to be a cluster?
Yeah, so I think the districts, all of them, Groton included, have tried to communicate about the cases that they become aware of to their communities. We work with the districts, as Jason spoke to. We've not seen large amounts of transmission happening in the schools. Most of these cases were able to determine that there was some exposure point outside of the school. To the previous question and this one, if we thought there was significant transmission going on within a school, we would be having conversations with the district about how to cut off that transmission, whether it is going fully remote, cleaning that needs to be done, those kind of things. But our districts have great plans in place. I think they're implementing them well, and we have regular communications as cases evolve. And if we thought there was a situation that the community needed to be aware of because of transmission, we would certainly let them know that.
And as a follow-up to that, because that question asked about an off-site student, what is considered an off-site student? Is it a student who is remote all semester, or does it include students who are temporarily remote because they were placed in quarantine or something like that?
That's probably another one of those words that's very general and means a lot of different things. Generally for us, what we're concerned about is exposure points, right? So if a student hasn't been to school for any of the reasons you just listed, they're fully remote, or they've been in quarantine, or I don't know, they took a family vacation that we asked them not to, and they weren't in school to expose someone, then from that point, we would consider them off-site because there's no exposure in the school. The schools might be using that term a little bit differently, for their communities and their constituents to describe what's going on. But for us, the definition essentially is if somebody was not on campus during their infectious period.
All right. Thank you. I think that's clear enough. Amy, how does the county monitor schools and businesses to ensure compliance with mask wearing, distancing, density, and so on?
Sure. So this is something that our public health department does regularly, and we work with their environmental health team, and monitoring, not only monitoring, but educating. A lot of times when we get concerns or complaints, it's just people not understanding what the practices are, what the processes are, or needing a little guidance. And so I would say that our environmental health team has done a really outstanding job working through that with everyone. There are times where they have to, really go in and help people understand the importance of how they do things, or allow them to talk through what they're trying to do. So that way we can make sure that those businesses and schools are continuing to operate and provide the services to their customers or their pupils, as well as making sure that they're all keeping them safe. So it's really, really working with the health department and others to make sure that everyone's working together on this.
So let me ask a quick follow-up question, because it's one that has come, and it could be for either you or Frank. So often people go into the grocery stores, they don't have an independent face covering, but they use their shirts or something and cover their face. Is that an acceptable face covering?
So technically it's not, but it's also a face covering in its attempt. I think that's the challenge with some of these things, is that we really want people to be using those face coverings that Frank talked about earlier on, having those double pieces of cotton and all of that, at the same time acknowledging that you have to use what you have. And there are some great tips on how to make, a t-shirt face covering that does meet those needs. So it's not really the face covering that we want, but we also acknowledge that people are doing what they can do with what they have. And so helping them do that. I know a lot of businesses and other places have started providing some masks at the front of the business. So as a community, we are trying to continue to do that. And there have been masks available and a lot of giveaways. So I encourage you to wear one of those masks rather than, rushing in.
Pulling my shirt up.
Yeah, and if you have to go home and get your mask, it will protect other people and help you out as well. So it really is.
All right. I hope the person who I encountered in the stores is listening. Like, it's not acceptable. Wear an independent mask.
Yeah.
Frank, you have anything to add to that?
No, I think Amy hit it on the head.
Okay, Amy, here's another quick follow-up for you on the question about the quarantine preparedness kit.
Mhm.
Aside from soap and water, which we know universally is very good to have, are there any other recommendations, or can people find this on the health department website for good hygiene or cleaning supplies to keep on hand? And if they can't afford it, where can they get it?
Yeah, so soap and water is key, Leslyn. I think you hit it on the head there. That's really, really the big piece, is having soap and water. As far as cleaning and disinfecting supplies, those are things that, are on that list, and continuing to wipe down surfaces, all of those kinds of things. So it's the same message we started with. And the key really is cleaning yourself, keeping your hands clean, trying not to touch your face, which every time, inevitably, when we're on this Zoom, I know I have to do it more than I have ever had to before, but all of those pieces.
Yeah. Jason, I started this town hall meeting just being saddened by what's going on with our federal government and aid to families, to municipalities, to our businesses, and encouraging people to reach out and talk to them and ask them to do better by us. We take care of our people. The COVID-19 rental relief through the Neighborhood Housing Services is still available for our community members. It's been difficult sort of getting the word out and getting people to use it. Why do you think that pot of money hasn't been used by the community to its fullest extent? And what can community members do to help get the word out? People are struggling, and there's money there.
Yep, that's a good question. I think to answer your last part of your question, what can community members do to get the word out, is just that, continue to push the word out. I asked Dominic to please post the link to the INHS website that has the rent relief information to it. So the more folks that are aware of it, the more folks can take advantage of the opportunity. This is something that we're going to evaluate, in the upcoming days and weeks as to what we can do to make this funding more accessible and easily accessible. Part of the challenge is that the money is tied to state and federal requirements, which sometimes have income requirements or asset requirements. So, for example, while the additional $600 of unemployment income was beneficial, it may count against in terms of an individual's income for qualifying. Other issues around the moratorium may have just postponed the inevitable. So nonetheless, we think that the applications are important. We still want people to apply. We still have funding available, and we're going to evaluate the program to ensure that if there are barriers that we can minimize or take away, we want to do that so we get the money on the street. I will say the county's extended its portion of the funding to be used into the summer, which is good. And if this moratorium is lifted, eviction moratorium is lifted, I have a feeling we may see more folks come to access that funding, and we want to be prepared to be able to release that money as quickly as we can, so it can get on the street and keep people in their dwellings and their homes, so they have at least a place to stay, because that's an important element of anybody's life, is ensuring that they've got a good quality place to live.
Thank you. I want to echo those sentiments, Jason, just encouraging people to spread the word. I'll put a plug in. I know that at GIAC, one of the things that we did is reached out to the folks at INHS, the IURA, and said, how can we be helpful? Not everyone knows or might feel safe, navigating the site themselves. So if there is a place where you feel safer, whether it's the Learning Web or GIAC or Southside Community Center, where someone can help you walk through the website to fill out the application and help with the follow-up, we're happy to do that. We also worked with INHS to get some paper applications just to help people with that, because not everybody has access to the internet or to a computer that they can do it. Some people might have issues with literacy. We have to take all those things into consideration. So I'm encouraging, other places to reach out to INHS, see how you can be supportive and helpful, so there are community members who are in need aren't struggling when there are resources out there. So I want to put that plug out there for it. Is there any last thoughts from any of you before I wrap this? Well, certainly, always lots of good information, good advice, and food for thought for us. We're excited about the vaccine. The thing we know about this virus, there's lots of unknowns, but the thing we know is that for some people, it's deadly. For others, they get mild symptoms and they recover and move on with life. But to protect everyone, we have to follow the guidance we've all been receiving and sharing since March. Wash your hands frequently with soap and water for at least 20 to 30 seconds. Wear your mask whenever you are going to be around people, regardless of whether you can distance with 6 feet or not. Keep that 6 feet distance between you and the other person. We really encourage all of those things, and as much as possible, avoid touching your face. Please, if you follow those guidelines, we can reverse sort of this curve in our community. We see the numbers upticking, and we want to bring those numbers back down. As the holidays come, we do want you to have merry holidays, but we want you to do it safely. Please, please, please avoid travel if you can. Celebrate within your own small clusters in your home. As Jason, or it might have been Frank, I think it was you, Jason, said, even traveling across town to go to, the friend's home. They may not have had any symptoms of COVID. It didn't show up in their home, but you're still exposing yourself and you're exposing them. So if you can, everyone, we beg of you to be patient. I know it's been a long haul. I don't want to be flippant about this, but as somebody who loves sports and looks forward to going to the sports club and getting out of my home and out of this isolation to be with people as I cheer for my Steelers football team, I can't do that. I pass by the sports club and I want to go, but I can't. I want to be with other people celebrating, but I just can't. It's the one outlet I have, and I just can't. So it's rough. I know it's rough. I will share personally. My son doesn't live with me, and he comes to my home, and I'm like, nope, you're not hugging me. If you didn't have on a mask, you need to back on up out of my house. Go back where you came from. As soon as you come in, wash your hands, wash your face. I take those precautions as well, and that's my own child. So we all can do. It's not like I don't love him, but we all have to do our little bit. It might be hard. Hang in there. Be patient. Enjoy the holidays, and let's come out on the other side of this as a community that is safe, is protected, it's ready to get back to some degree. I'm going to use this word, although I hate it, of normalcy. But what we've known, but we can only get there if we do the things that we're asking each of us to do. Thanks to our nurses, thanks to our health department staff, thanks to our administration, thanks to the folks in the EOC, all of the staff folks who have taken reassigned duties from their normal duties to help in this situation, the contact tracers, the people who are volunteering to shop for our seniors or deliver meals, just everyone who plays any part in helping us to keep our community safe and helping us to support each other. Big thank you from all of us in Tompkins County government. We really appreciate everything that you're doing and encourage you to continue to do what you can. Make those phone calls. Let people know you're thinking about them. It's extremely important. On that note, I am hopeful, I am thankful, and I wish nothing but peace and blessings and good holiday wishes to all of you. Thank you for tuning in.